Reporting to the media this week at Post-Executive Council Media Briefing is the Secretary in the Division of Finance and Enterprise Development, Assemblyman Joel Jack, and the Secretary with responsibility for Health and Social Services, Assemblyman Claudia Groom-Duke.
I think by now we're all aware that June 22nd is Budget Day in Tobago. And as Secretary with responsibility for Finance, I have the pleasure of delivering my third budget presentation in this administration. And as we put forward the estimates for expenditure for fiscal year 2016, I must agree that while there's an air of uncertainty that exists in the country with respect to the national elections that will be held on September 7th, the Tobago House of Assembly, we still have a responsibility as outlined in the Tobago House of Assembly Act and by law that we submit by June 30th of each year the estimates of expenditure and revenue for the Tobago House of Assembly. I must say we are well on our way to finalizing the figures and the budget statement. And I must commend all divisions for participating in this process. They have submitted their estimates and the budget document is finalized, and basically we're ready. I wish also to express my sincerest thanks to the Trinidad and Tobago Chamber of Industry and Commerce, Tobago Chapter, the Tobago Agro-Processors Association, the Tobago District Agricultural Society, the Tobago Hotel and Tourism Association, and the Bankers Association of Trinidad and Tobago, and also representatives of the labor movement, and also the credit union movement, and all sister secretaries and assistant secretaries for participating in this exercise. And we must compliment all the stakeholders for their involvement again this year. And I must say that all their contributions will shape the budget document. Additionally, as well as the consultation, we have adopted a new process in that we conducted another survey as we sought to broaden the consultative process, and we spoke to a lot of Tobagonians as to some of the areas that they would like to see in the budget, and I must also compliment them for participating in this exercise. This year we proposed to, in the budget document, we propose to treat with a lot of outstanding issues and challenges with respect to Tobago's development. We also will factor in the drop in oil prices as we manage in this environment of uncertainty. The budget presentation will share with Tobago and the wider national community and the international community the intent of the Assembly to explore new opportunities for economic growth and wealth creation. And we'll treat with several pertinent developmental issues, including improving the economic environment. We will look at revitalizing tourism and enhancing our social services. We'll also articulate some of the issues and challenges, and how we propose to surmount some of the challenges that we have faced as an administration with respect to a number of issues, financing Tobago's budget. So I must ask all of Tobago to listen in, those who are able to come to the THA chamber and listen. I think this year's budget as all other budgets are important, but this year's budget, you know, is really important to all of Tobago. You may recall in last year's budget presentation that the Assembly requested a total sum of $5.8 billion. And this was comprised of $3,136.3 million for recurrent expenditure, $2.55 billion for the development program, $78.3 million for URP, and $54.2 million for CPEP. What we actually received was $2,617.2 million from central government, or approximately 55% of what the Assembly requested. And what we received included $2,201.8 million. Sorry, let me see that over again. $2,201.8 million for recurrent expenditure, a shortfall of 30%. Under the development program, we received $384.4 million, a shortfall of 85%. And under URP, we received $23 million, resulting in a shortfall of 71%. And under CPEP, we received only $8 million, a shortfall of 85%. I want to focus my attention now to an issue that the last time I was here, I spoke about with respect to the shortfall in funding to the Tobago House of Assembly to the tune of $102 million. And what I just want to put on record is the response from the Minister of Finance the last in the Senate on the 11th of June, and his response to my emails. And the minister indicated that I have a copy of the Hansard which I could share with the media at the end. And I'm quoting, an issue which has come up has been the question of the Tobago House of Assembly and the amount which was given to the Tobago House of Assembly, and the fact that there was a shortfall of about $102 million. And I'm quoting again, I want to say that it is something that we have sought out with the Tobago House of Assembly. And he said, I've received some figures earlier today which suggested that the difference may not be as wide as the THA has indicated, and we need to do some work on it. And he's saying that the amount which the Tobago House of Assembly should have gotten for the quarter should have been $543.6 million. He also said, and I'm quoting, so I think the issue for us, and I have to admit that we ourselves perhaps should have been more proactive in working with the THA to have this matter sorted out. And I have to say that the Tobago House of Assembly has been very proactive. They have reached out. He said, as Senator Cudjoe mentioned, a couple of emails that they have sent, but more than that, Mr. Jack did call me, did call himself. I did speak to him. I have to get back to him, which I have not done. And similarly also, the Chief Secretary did call. Right, so I'm just quoting. But what is also a cause for concern is part of the minister's statement when he said that the Ministry of Finance and the Economy made two adjustments, one for actual revenue collected by the Tobago House of Assembly for the first quarter, which we estimate at $68 million, and a further adjustment for the amount transferred to the development program by the Tobago House of Assembly in the second quarter of $79 million. Now, this part of the statement is cause for concern. because as an assembly, we are empowered to shift resources and to allocate resources where there is a need. And this $79 million should not have been factored into the equation in terms of, with respect to the allocation to the Tobago House of Assembly for the third quarter. So again, this is the 11th, I think today is what, the 17th? We still have not had any final word from the Minister of Finance with respect to the shortfall in funding to the Tobago House of Assembly. So again, we wait on the Minister with respect to that shortfall. But another point I would like to raise in terms of how this Assembly, how we have managed, and the fact that we have managed well over the years. I must put on record that given the shortfall in funding to the Tobago House of Assembly for our Tobago development program, when you receive only $384 million, and you already starting with a shortfall, we would have hoped that the minister, in terms of when he was doing his calculation with respect to the variations, would have considered the shortfall in funding to the Assembly earlier in the year. But what we see happening is something different. With respect to the supplemental, the variation bill that was submitted to Parliament, Tobago received only $110 million to treat with the payment of arrears and salaries to our dear and beloved daily, monthly paid and teachers. However, that $110 million is still inadequate to treat with the total payment of arrears to public officers. And that arrears in total comes up to $137 or so million. So there's still a shortfall with which we will have to treat with. Also, persons would have noted an increase to CPEP, expanding the CPEP program in Trinidad. But in the Tobago context, CPEP received no additional funding. And we only received $8 million, or 85% of what was requested to run and fund and manage CPEP in Tobago. I know my colleague, Mrs. Groom-Duke, would have been happy to receive some of that additional funding. We received no additional funding for URP or for any of the social programs, where on the contrary, we see the opposite happening. We have received no additional funding for housing and any of the more important activities that we were trying to execute here on the island. What I must say, and again, I must reiterate that we have managed our finances well, and we have done so not only for the current year, but we manage for the next year. And this happens because of that perennial shortfall in funding issue. What I would hope this year is that we see, and in anticipation of a new Minister of Finance coming on the scene next year, and more than likely a P&M Minister of Finance, we would anticipate greater collaboration with the ministry, with the Minister of Finance, in allowing Tobago to access alternative funding mechanisms. Because you have to ask the question, if we did not manage our resources well, how many persons from CPEP would have had to go home if we did not have that buffer in terms of financing the shortfall? How many single mothers, single parents, and how many households who depend on a lot of our social programs, who depend on URP and CPEP for their daily existence? If the House of Assembly, if we did not manage our resources well, what would have happened to those persons?
I want to start by welcoming and by joining with the Tobago Regional Health Authority and managers to welcome our newly appointed Chief Executive Officer, Mr. Brent Peter Murphy, to the Tobago Regional Health Authority. Mr. Murphy was born and grew up in Delaford, Tobago, and for that, we are quite happy with our education system, the primary and secondary education system in Tobago. He attended the Delaford RC and AC schools, and he also attended the Roxborough Composite School before he relocated to the sister island of Trinidad, where his personal and professional development continued. Mr. Brent Murphy achieved up to a Master of Business Administration degree. I have a copy of that document with the Accreditation Council of Trinidad and Tobago, indicating a statement on recognition on his behalf, who holds the qualification of Masters of Business Administration degree awarded by Anglia Ruskin University, United Kingdom, in February 2012 at SAM Caribbean Limited, formerly known as the School of Accounting and Management in Trinidad and Tobago. Anglia Ruskin University is quality assured by the Quality Assurance Agency for Higher Education at UK, and SAM Caribbean Limited, formerly known as the School of Accounting and Management, is registered by the Accreditation Council of Trinidad and Tobago and was authorized to deliver the program. The Master of Business Administration degree is recognized by the Accreditation Council of Trinidad and Tobago. Mr. Murphy also worked as clinical and quality assurance manager with the Global Medical Response of Trinidad and Tobago Limited from 2005 to 2013, and then he moved to the Northwest Regional Health Authority as hospital administrator from 2013 to present. So when we do the math, the arithmetic from 2005 to present, we would see he would have done more than 10 years in service. So we really want to welcome Mr. Murphy, and at the same time to celebrate the education system in Tobago in terms of the preparation for our students here, that all of our schools are excellent schools. The second point I want to make is to speak on the Caribbean Medical Conference that was recently held over the period June 12th to 14, and to say how successful that conference was. We really want to congratulate Dr. Gerard Antoine, the founder of the Caribbean Medical Professionals Practicing Abroad, to come to Tobago with a cadre of over 24 international presenters from various parts of the United States of America, and 14 local and regional presenters. They were all giving back to the country, and that is so commendable. This was the second conference. The first one, which was held last year, was held in Trinidad, and this one was held in Tobago. And so we really want to congratulate the team, as well as to really demonstrate how we benefited in Tobago from this particular conference. On the On the 12th in itself, where the session was on cancer rehabilitation, over 150 persons attended. And then you had the Community Cancer Education Forum, which was held at the Scarborough Library Auditorium concurrently. And that too was a very healthy session, very interactive, many people asking questions. And the session was well attended and well received. In terms of the program in itself, after the meet and greet on Friday evening, which allowed for people to interact and know each other and so on, feel comfortable, we opened the second day at the Magdalena Grande, where the lectures by various practitioners were held, and all experts in their various disciplines were able to present their research study and findings and so on within that particular conference. We would definitely do a press release in terms of the outcome and how we benefit in Tobago from the conference. Nonetheless, we really want to bring to bear on in terms of High Point, the issue of prostate cancer, cervical cancer as well. And in keeping with Father's Day this weekend, we really want to remind the men that we must do our screening. Nevertheless, since the research of Dr. Patrick and the team on prostate cancer, we see the reduction of persons dying from prostate cancer on the island. And so we really want to indicate to the healthcare professionals, to TRHA, and really to commend them, the Division of Health and Social Services, members of staff, for really being part of this particular conference and what it brings to the Tobago scenario. I also want to use this opportunity, we've said it before, but the Trinidad and Tobago Registered Nurses Association has just concluded its 85th anniversary celebrations. And, with a week of activities from the 31st of May, culminating in an award function, I really want to join the Tobago Regional Health Authority to again commend our own nurse Denise Lashley Agard, who was awarded the Trinidad and Tobago Nurse of the Year. And members would recall Nurse Karen Frank from the Oncology Unit, who was named the Trinidad and Tobago Nurse of the Year last year, and also nominated Caribbean Nurse of the Year at the 29th Caribbean Nurses Organization Conference that was held in St. Lucia. I really want to mention these two nurses, and of course, all the nurses on the island, other medical healthcare professionals, for the kind of work that they are doing at this time. I've been seeing on the media a number of people now indicating the kind of care and support and the attitudinal change among the staff. The Tobago Regional Health Authority would continue to treat with the attitudinal change issue within the Tobago Regional Health Authority. And finally, I want to speak to the new Zika virus that is impacting on, impacting Brazil, and therefore we are on alert. You know, the Caribbean's tropical climate has been susceptible to mosquito-borne diseases such as yellow fever, malaria, dengue fever, and most recently chikungunya. And now we're speaking about Zika. And we really want to let the public know that the Office of the CMOH and the Public Health Department, these departments are on the alert for the Zika virus, a mosquito-borne disease which is transmitted by the same vector that carries the dengue and the chikungunya viruses. And so the Division of Health and Social Services is monitoring our ports of entry, and once again we are advising persons to keep their surroundings clean by preventing unnecessary water collection to avoid the breeding of the Aedes aegypti mosquito that carries the Zika virus. And so we really want to let our public know that the Zika virus is generally found in and around places where people inhabit. And so persons are urged to keep their surroundings clean by cleaning their drains, getting rid of stagnated water that could potentially be a mosquito breeding ground, and search for and destroy other mosquito breeding sites by getting rid of old tires and containers in which water can settle, and punching holes in tins before disposing, and covering large drums, barrels, and tanks holding water. We must remind our people about this, because we really do not want to get any bites from mosquito, especially Aedes aegypti mosquito. As you know, the Division of Health, through its public health services, we have been conducting a blitz program. We started from the Charlottesville end, Charlottesville to Pembroke end. That was covered, and spraying will reach Mount St. George. We are continuing throughout the island. We must let people know, but we want to remind you that we started our work where sometime last year, January, we started doing our spraying and so on while we were treating with chikungunya. We just continued. And so we are working assiduously in terms of the prevention and, of course, public education on the Zika virus is currently being done at the health centers in Tobago, and we are definitely going out to the community to ensure that all of our people are aware and taking action in response to this impending Zika virus, especially we're now going into the rainy season. Yes? So, two, I really want to commend the staff, because they are really working overtime to be out there. And please call if you have like white waste, because we see this as a source for the mosquito breeding. And we are working on removing white waste. Those persons who do have white waste to be distributed, make a call to 211. They will call the Public Health Department, and your white waste will be removed. But we must remind our people that removing white waste is our responsibility.
Thank you for tuning in to another Tobago House of Assembly's Post-Executive Council Media Briefing for the week ending June 20th, 2015.